The human gut microbiota, a complex ecosystem of microorganisms residing in the gastrointestinal tract, plays a crucial role in maintaining overall health and well-being. Recent research has shed light on the intricate interplay between gut microbiota composition, intestinal health, and various physiological processes. Among the factors influencing gut microbiota dynamics, the presence of intestinal worms and stool consistency have emerged as significant determinants with profound implications for human health. Intestinal worms, a persistent challenge. Intestinal worms, also known as helminths, are parasitic organisms that reside in the gastrointestinal tract of humans and other animals. These parasites can cause a range of health problems, including abdominal pain, diarrhea, malnutrition, and impaired growth and cognitive development, particularly in children. Despite advancements in healthcare and sanitation, intestinal worm infections remain prevalent in many parts of the world, particularly in low-resource settings with poor sanitation infrastructure. Stool consistency, a window into gut health. Stool consistency, often assessed using standardized scales such as the Bristol stool scale, provides valuable insights into gastrointestinal function and health. Normal stool consistency reflects a well-functioning digestive system, while deviations from the norm may indicate underlying gastrointestinal disorders or imbalances in gut microbiota composition. Changes in stool consistency, including diarrhea, constipation, and alterations in fecal texture, are commonly observed in individuals with gastrointestinal conditions and can significantly impact quality of life. The gut microbiota, orchestrating intestinal harmony. The gut microbiota comprises trillions of microorganisms, including bacteria, fungi, viruses, and archaea, which inhabit the gastrointestinal tract. This diverse microbial community interacts with the host organism in a symbiotic relationship, influencing various aspects of host physiology, metabolism, immunity, and even behavior. The composition and diversity of the gut microbiota are influenced by numerous factors, including diet, lifestyle, genetics, medication use, and environmental exposures. Interplay between intestinal worms, stool consistency, and gut microbiota factors. Emerging evidence suggests a complex interplay between intestinal worms, stool consistency, and gut microbiota composition. Intestinal worm infections can disrupt the delicate balance of the gut microbiota, leading to dysbiosis characterized by alterations in microbial diversity and abundance. These disruptions can trigger immune responses and inflammatory reactions within the gastrointestinal tract, contributing to changes in stool consistency and gastrointestinal symptoms. Conversely, alterations in stool consistency, such as diarrhea or constipation, can also impact the composition and function of the gut microbiota. Diarrheal illnesses, whether caused by infectious agents or other factors, can lead to shifts in microbial communities and reduce microbial diversity. Similarly, chronic constipation or bowel motility disorders may alter the gut microbiota composition and promote the growth of opportunistic pathogens. Moreover, the presence of intestinal worms can influence stool consistency through direct mechanical effects, such as intestinal obstruction or inflammation, as well as indirect mechanisms involving immune modulation and alterations in nutrient absorption. These effects can further exacerbate gastrointestinal symptoms and disrupt gut microbiota homeostasis. Clinical implications and future directions. Understanding the intricate relationship between intestinal worms, stool consistency, and gut microbiota factors holds significant clinical implications for the diagnosis, treatment, and prevention of gastrointestinal disorders. Strategies aimed at restoring gut microbiota balance, such as probiotics, prebiotics, and fecal microbiota transplantation, may offer promising therapeutic approaches for managing intestinal worm infections and associated gastrointestinal symptoms. Furthermore, efforts to improve sanitation, hygiene practices, and access to clean water remain critical for preventing intestinal worm infections and reducing the burden of gastrointestinal diseases worldwide. Continued research into the mechanisms underlying the interactions between intestinal worms, stool consistency, and gut microbiota factors will enhance our understanding of gastrointestinal health and inform the development of targeted interventions to promote intestinal harmony and well-being. Moreover, advancements in technology, such as high-throughput sequencing and multi-omics approaches, offer unprecedented opportunities to explore the intricate relationships between intestinal worms, stool consistency, and gut microbiota factors at a molecular level. By deciphering the dynamic interactions within the gut ecosystem, researchers can identify novel biomarkers of intestinal health and disease, as well as potential therapeutic targets for intervention. In addition to the clinical implications, understanding the interplay between intestinal worms, stool consistency, and gut microbiota factors has broader implications for public health and epidemiology. Integrating this knowledge into public health initiatives and policies can help prioritize interventions aimed at reducing the burden of gastrointestinal infections and improving sanitation infrastructure in at-risk populations. Furthermore, education and awareness campaigns can empower individuals to adopt healthy behaviors and hygiene practices that mitigate the risk of intestinal worm infections and promote gastrointestinal health. By fostering a comprehensive understanding of the complex interrelationships between host, environment, and microbial factors, stakeholders can collaborate to develop holistic strategies that address the multifaceted challenges associated with gastrointestinal diseases. The link between intestinal worms, stool consistency, and gut microbiota factors represents a fascinating area of research, with far-reaching implications for human health and well-being. The intricate interplay between intestinal worms, stool consistency, and gut microbiota factors underscores the complex nature of gastrointestinal health and disease. By unraveling the mechanisms driving these interactions, researchers can pave the way for innovative approaches to diagnose, treat, and prevent gastrointestinal disorders, ultimately improving the health and quality of life of individuals worldwide.